can start, Shiv.
Hi all, good evening and good morning. I'm Shivakumar, working as a lead consultant in GAPS Technologies and leading data privacy function. I'm glad to welcome you all to the webinar on cybersecurity threats and challenges in the healthcare industry, hosted by GAPS Technologies, a leading global IT services provider with focus on AI-led managed services and digital transformation. In association with Sekion, a leading cybersecurity advanced threat management platform. Now I would like to introduce our speakers. Chandra S. Pandey, founder and chief executive officer of Sekion, and Kavita Srinivasulu, head cybersecurity and data privacy for healthcare vertical. Over to Chandra, followed by Kavita for brief introduction.
Yeah, hi. As Shiva pointed out, my name is Chandrasekhar Pandey. I'm founder and CEO of Secyan Incorporated. And the organization I started Secyan from the day one is focused on the comprehensive cybersecurity for digital era. We started around almost 6+ years back, and since day one, we wanted to develop a platform, not just another feature or functional product. And that one has definitely, when we got into the market from the day one, when we mentioned about ML and AI into the cybersecurity industry, because the amount of the data being generated, no matter how many humans you have, you cannot be able to like go in and look through the data and discover any of those anomaly and threats and all that which are coming through those. So that way, when we started talking 6.5 years about that into cybersecurity industry, it was unheard of. And a lot of the cybersecurity gurus, they will say, oh, it's not going to work. When we came out of the product like almost 5 years back, now we have more than 5,000 customers in different sectors, a lot in healthcare. We have pretty much changed the spectrum. Now, if you look into most of the company, even if they may not have MLAI, they will always use the word MLAI. So we are pretty kind of excited about what we have been able to do and what we are doing each and every day. And whether it comes down to is like our partners and customers serving like healthcare or any other sectors. And we definitely, our focus is being proactive in detecting those threats, providing comprehensive visibility, proactive detections, and stopping before it kind of becomes a impacting event. And that's where we are focused on. And we will cover a lot more details as we go through the discussion today. Thank you.
Thank you, Chandra, for a brief introduction. I'd like to introduce Kavita. Kavita, please introduce yourself.
Thank you, Shiva, and thank you everyone for joining this call today. Good morning and good evening, where as we are meeting here today. This is Kavita here, and I'm coming with a strong background around cybersecurity and data privacy. I have overall 18+ years of experience, in and around, working across global companies like Wipro, Verizon, Bank of America, HCL, AstraZeneca, and currently with GAVS. At GAVS, I'm handling both cybersecurity and data privacy, delivering services across global clients. I'm here with you today to discuss share my experience across various cybersecurity threats and challenges that we all are facing today in the healthcare industry specifically. As all of us know, in healthcare industry has become one of the key target and key, focus area for, cyber threats. So let's discuss in detail, on the flow, and I would like to hand it over to Shiva to start off. Thanks.
Thank you, Kavita. So today we are here to discuss on one of the most crucial topic, I would say, cybersecurity threats and challenges in healthcare industry. As you all know that the healthcare industry is one of the prime targets for cyber criminals, as COVID-19 has challenged the resilience of the entire global healthcare information system. The pandemic actually has resulted in a number of recent cyber attacks on hospitals, pharma companies, US Department of Health and Human Services, even the WHO and its partners and others. Even cyber criminals now can swiftly sell patient, medical, and billing information on the darknet and dark web for insurance fraud purposes. One of the other thing which we will also touch base is on the internet connected medical devices which are susceptible to tampering. So to protect against this type of attack, there are a number of levers that needs to be activated. One such as anti-malware protection, backups, and continuity, and also by establishing a safe and cyber hygiene of the for the culture of healthcare cybersecurity. So let's, as we have our industry leaders here, let's get insights from them. So before that, I'd like to bring up a poll question so that we can also have an discuss. I mean, we can have the pulse of the audience on the topic which we are going to discuss today. So I'd like to bring up the poll question. Okay, so we'll take a quick look. Uh, what do you think is the biggest challenge healthcare organization is facing as it pertains to the cybersecurity? Meeting regulatory requirements, ransomware attacks, responding to cyber incidents, all of the above. Let's take 30 seconds for the audience to mark their response. Post that we will discuss with our industry experts. Yeah. Okay. So let's discuss on the response. Chandra, we have the response, and we
Yeah,
can
so
discuss.
it's a pretty interesting, and it's pretty much what we can see from the industry as well, that definitely you want to address all of those. But at the same time, some of the participants mentioned about the ransomware being a kind of their main concern. And because they might have already have a set of the solution which is meeting their regulatory requirement, and then they might be able to investigate when the event has happened. And so if you look into all of those things are important, those which chose probably ransomware because they already have the other two solutions in the place, because that's pretty clear that that might be happening in there. And if you look into it's a really critical point of view, definitely means the regulatory requirements, whether it comes down to the HIPAA or digital rights and all those, have a big role you have to kind of like do, that any healthcare provider have to make sure those requirements are met, compliance requirements are met. But the ransomware is definitely on all of the healthcare providers. Either they are kind of afraid of getting kind of like attacked, or they have been already attacked in there and they can be attacked all over again. And the reason is very simple, because what happens in the healthcare industry is not at the same cutting edge in the cybersecurity as the financial industry, which is spent in their IT budget is almost 7% of their total budget. For the where when it comes down to your financial industry, IT budget for the healthcare industry is 1%, sometimes even less than 1% in there. So what end up happening is they don't have all that sophisticated tool. They don't have enough of the staff to run all those sophisticated tool as well. And the ransomware also, what has happened is there is cyber criminal have done the automation. And when you have the automated framework to go after an organization and attack organization, the healthcare industry is very easy target because they don't have same sophisticated set of the tools. And then on top of that, the the value you can derive from the a successful breach is very high. Because if you look into when you are working in the financial industry, you got somebody credit card and all that, maximum for each credit card, you can get $1 or $2. But then what happens is, as soon as those are reported, the credit cards are canceled and the new credit card are issued, new number account is closed and all that in there. So the cost on those cards have come down significantly in the last like 5-6 years, so that finance industry, the cost of the breach is much more lower. But if you go in and if you get a breach where you get the healthcare records of like thousands and thousands of like the healthcare service takers, now those records are very costly. They can be sometimes like hundreds of dollars. It can be like $20-$30 to multiple hundreds of dollars. And the reason is the value they are able to, criminals are able to drive a lot more, because it has information about your social security, it has your name, address, everything is all that in there. And all the records are kind of like pointing you that where they can go and even open the new accounts. They can even do the fraud can be done in the healthcare. Insurance fraud can be also taking place. People can even open the new kind of like a loan, and then they can get a loan against that. So those, because of the data which had so much information about an individual, that has a lot more value. And then what happens is also one of the biggest challenge the healthcare industry is facing is when they go through it, each of those the records, even though they might have a way, they might have a backup, and they might know that, hey, if the data have not been encrypted, there no have been successful encryptions and all that in there. But as soon as they start getting a ransomware demand, more likely they are willing to pay for it, because they are afraid of that data being used and creating a much more significant damage down the line. So even they might be able to back up and get up and running, but still they are willing to pay the ransomware. And that is something which is like also have to be kept into the consideration, because of the kind of the data involved and all that. So it's like one thing is like getting the impact on the operation, which can be life affecting operations for the patients which are getting the services and all that. But the other thing is also keep in mind that just like they do not want that information to go out, so they are willing to pay, even though they are able to operate and get the backup data to run from, they are willing to pay for it. So that's something I
Yeah,
just wanted to kind of share based on our experience we have seen.
definitely, Chandra. Like there is a study that our cybersecurity experts state that the price tag for one PHI records on the dark web is around $250. So I can clearly make the point from your from your statement that the cost of the PHI is comparatively higher when in the healthcare industry, like how they sell it in the dark web. So, and also day by day, we are hearing news on the emerging threats and challenges, specifically high in healthcare industry, as we are in new normal where the remote working has become the new normalcy. So, Kavita, what are your views of the challenges that lie ahead for us, and what changes has the COVID brought in the healthcare industry?
Sure. Thanks. And first and foremost, the healthcare industry has demonstrated its resilience during this COVID period, bringing in new, new technologies, new innovations in the market. If you see, medical industry or this healthcare industry has become the most expensive industry, compared to others, because it before COVID, if you see, this is one of the healthcare vertical which was present compared to others, because in one time if you see the financial domain or financial vertical and transportation, manufacturing industries, all of them were really highly critical, and the cybersecurity services were highly concentrated in that. But once this COVID has come in the recent years, healthcare has brought in a lot of changes and a lot of things, if you'd see like AI, artificial intelligence, that definitely brought a change in the type of x-rays, that can do a better job than the radiologist, and there is also IOMT, which is introduced to manage medical devices and clinical applications, and some vast improvements in population's health information like personal data management through big data and analytics, to just name a few. But what has parallelly happened is, as the technology grows and being in the prime of the situation currently due to during this pandemic period, the healthcare system has become highly vulnerable. The industry's responses has become highly resilient in nature, and their ability to respond to the attacks that is happening, or for example the ransomware attacks, if we pick up, it is minimum 90% of the healthcare industries have faced a ransomware attack in the past 3 years, according to the surveys that has happened, be it Gartner or McKinsey. The surveys clearly shows that the healthcare industry is highly vulnerable during a crisis situation. So far, the major challenges that they are facing in this industry is, first and foremost, there is a vulnerability in the systems that they are maintaining, which is which is old and legacy. There
Yep.
is the be it a system that they are maintaining, or the kind of tools that they have in place to ensure the data is protected, and it is ensure that we are staying proactive in managing the devices or managing the clinical application that we on a day-to-day basis we are managing humongous patients data. And another a weak area that we have is on adhering to these standards. So there is
Definitely.
always a challenge that is raised in the market, that compared to when there is comes a ransomware attack or any kind of data breach that happens, there is a question in the market that arises, that who owns this, who's liable in the exploitation or the theft of the data. So that's when the regulators came into picture. While the industries are facing unprecedented disruptions and not knowing who should take the ownership, and where the liability should be, that's when the regulations came into effect very
Yep.
effectively, to ensure the the data breaches or the security threats that's evolving in the market is addressed and the ownership is given. So the adherence to be it a privacy act or the ISO standards or regulations has become highly important and mandatory in healthcare industry, which is definitely being a big challenge to the healthcare industries to face it in the vast environment. So
Yeah,
these are the some of the challenges that I would highlight, Shiva.
definitely, Kavita. So, on the compliance part in the healthcare industry, when we think about the compliance, usually it comes to our mind is HIPAA is the first complaints which comes into everyone's mind. So, although HIPAA has been around for 30 years, healthcare organizations have always had a hard time for satisfying all of the HIPAA requirements. Hackers continue to target healthcare organizations to get their hands on PHI data. And as I explicitly said before, on the
Mhm.
dark web, the one PHI data is sold around for $250. So, what are the explicit HIPAA requirements and the recommendations, and what are the satisfying requirements an organization need to be HIPAA compliant?
Okay, so to talk about HIPAA compliance, HIPAA itself, it's mandated, especially in the healthcare industry, irrespective if they are payers, or if they're going to be medical devices or hospitals or any kind of healthcare industry. It is really important to take appropriate safeguards to protect the privacy of the personal health information that they are maintaining on a day-to-day basis. When we are talking about patients data, it is not minimal. If you take up the history, for the past 6 months, the kind of data breaches or the ransomware attacks that's been happening, if the number of patients data that is lost is not one or two, but in millions of
Yep.
data are getting exploited, and the data is getting disclosed humongously. So if we have to address and safeguard the data, what are the some of the compliance requirements in HIPAA, if we could highlight? If there are four important requirements under HIPAA. First and foremost is the organizational requirements. We'll have to ensure there is a very clear, team, a compliance committee or a compliance officer that is designated to ensure there is there is adherence to the standards and the regulations that is need to be complied with. That is very important. And the second area that is very important from the organizational requirements perspective is you will have to have the trainings that is given to the employees on an ongoing basis, because globally highly vulnerable and highly weak area behind these data breaches and ransomware attacks is insider threats, because the awareness has become a very big gap that needs to be addressed by the organizations. And another important area that is coming into picture through by HIPAA is physical safeguards. We'll have to ensure when we are talking about physical, we have to ensure there is a proper facility, there is proper infrastructure, and device accesses are provided and clearly maintained, and there shouldn't be any kind of unauthorized access or unauthenticated access that is prevailing in the market, which will definitely give an influence to the hackers or the criminals to hack the systems. And another important safeguard that comes into picture is administrative safeguards is more of related to your safeguarding of the security controls plays a major role over here, be it periodic assessments or doing a risk management of all the clinical applications or the medical devices or the data center where we are storing our data and maintaining the critical information. We'll have to ensure there is a risk management that is effectively managed in the companies, and we'll have to also ensure there is a proper records the storage of records should be compliant in business, not only from HIPAA standpoint, but also from the privacy acts. From when we are taking, privacy acts like GDPR or PIPEDA or CCPA, they mandate for the data storage, in ensuring the data is stored, and we are taking precautionary measures to ensure the data wherever we are storing is protected, and the usage of the data is authorized, and if the purpose of the data is well defined and managed, and the access to the data is minimized, and wherever the data that we are managing is masked or is pseudonymized based on the security requirements that we have. So administrative safeguards plays a major role, not only from the internal controls but also to align to or adhere to the industry standards. And last but not the
Definitely.
least, one other important safeguard that we have to look into and keep in mind is the technical safeguards. So technical safeguards, revolves around the access controls that we'll have to ensure, be it with the, the employees, or be it with our third parties or the suppliers that we are working with, or, ensuring, whatever projects or the engagements that our team is working on, they have a well authorized role based, or they have a privilege access that is enabled to ensure there is the data that we are working on is authorized, and not anything that is unauthorized is prevailing in the environment. And the audits, audit controls, or it might be
Yeah.
with the kind of security controls that we have in our environment, from the infrastructure, from the data privacy perspective, we'll have to ensure the technical safeguards are strengthened to comply with the regulatory requirements. So that I think those are the few things that I can
Yeah.
highlight, Shiva.
Yeah. Thank you, Kavita. Like you have explained on the safeguards, which are very much required in the to be for an organization to be HIPAA compliant. Since you touched upon the data, so I'd like to have a note. Like another growing threat in healthcare security is found in protecting data. As pacemakers and other equipments become connected to the internet, like we have the IoMT medical devices, they face high level of vulnerabilities in safeguarding the patient's personal data. Chandra, what's in your view are the necessary security measures recommended to protect the data?
Yeah, so as Kavita pointed out, Kavita had some really kind of a great points in there. A lot of times people look into the compliance separate from the like the protections or detections and all that, but they are, if you do it right, they are all connected. So as she was pointing out, that, any of the, you have to have a control, and then after that you have to monitor that what is happening in the environment. So let's say whether it's a pacemaker you have, or you have a scanner, or any of the monitoring devices you have, which are the kind of the hospital peoples are getting monitored on those ones and all that. All of these devices now they are connected, and you want it to be connected because you always have to look into the risk as well as is like what is the value you derive from it. So if you look into the practical purpose point of view, whether you have a pacemaker or ventilator, or even the healthcare, the monitoring devices when you are in the critical care or emergency care, or a scanner, the reason you are able to get a lot of decisions are being made pretty much into near real time, even in the healthcare industry, is possible because of those devices are connected. And you can have like your results which can be monitored by a doctor who is like very far away, and then not only one doctor but hundreds of doctors can be looking and putting their opinion, or maybe even kind of getting on the conference call to discuss those. And I will kind of like share with my own personal experience, with like till like last 2 years, I have never been into the hospital. And then all of a sudden, I landed in the hospital one day. I did not know what is the reason for it, but then I'm hooked up with the like 50 different devices, and 20 different doctors are looking at at any moment of the time, and they are all discussing it, and I'm all questioning them what is going on. And there are a lot of doctors which are even invisible. I've never met them. That's right. And I can tell you that these interconnected devices have played a very big role in the healthcare industry. And we do understand that connecting those into the internet and all that in there, or even connecting them together, if somebody is kind of hacked, as Kapta pointed out, somebody gets into which is not need to be there, they can create a lot of kind of disruptions, and some things can be delayed into the decision-making process. Sometimes it may be life-threatening itself, but they have played a big role into helping out the kind of the people who are delivering the services and the people who are getting the services. I can be one who can tell that probably in the last 2 years, I lived in hospital for multiple months. And definitely you never want to be, but when you want there, you want to get the best care possible. And I'll tell you, when I was in the hospital, after a month or so, I came out and all that in there, and still I was working. I'm a cybersecurity guy, so every day I'm working as if I'm not in the hospital, but I'm kept in the hospital. So I met one of my friend, and as I was having a discussion with him, he said that, hey, look, in the healthcare, he had gone through the similar situation few years before, and what he pointed out, Chandra, in this industry, what happened is, since you are getting the services of like 20, 30 different doctors, and sometimes they are not able to coordinate it all together. So you might be getting some medications which may not be kind of like really supposed to be given to you. And you have to look into your record all the time, that what is working, what is not. So I'll tell you, this whole kind of like, we talk about this, the digitization of all your care providers and all the data about it. So one of the things he said, that you have to make a chart of what has worked, what has not worked, and all that in there. And when I'm in the hospital, or even I'm at my home, now, just because of all these digitalizations, and then we are talking about, it's like you ask me, it's like I go in the hospital, they will put a tag on me, and then they now have a HIPAA bucket. When they cut my tag, they will put into that bucket itself that this is a HIPAA bucket and all that in there. You are talking about the training. So one thing which was really kind of surprising to me, he was telling you have to keep a record. And then I kind of went and talked with my doctors, and they said, you know what, look, we can even analyze it. Let us show you. So we can go in, and a specific type of result you are looking into. You are looking to your blood count, or you're looking to anything you want. you can go and look into the history, and that history can be multiple years. When I'm perfectly healthy down to the like when I'm going through the treatment, I can look all that in the chart form. I can look into the absolute value form, and the decisions can be coming out of that. And it's like that whole interconnectivity and having the digitalization of the data has helped you quite a bit. If you ask me, it helped me quite a bit. Means today I'm over here completely healthy, and I have to thank all those kind of like the people who have been behind those digitalization and
Yeah.
bringing it all together. Doctor decisions are coming out in the like you sit in the room and within 10 minutes you have all the results coming out, and people are kind of like saying, hey, this one is good, this one is something we have to watch for. So that digitalization is very important. Now, how we safeguard, where you put into the
Yeah.
control, as like Kavita was pointing out, that all of these devices are connected. Some of these devices might be even out of lives, like, it's like a support, because they might have the older OS or
Yeah, the
applications,
legacy systems.
yeah, legacy system which may not be in the support and all that. But you think it's like something good has happened from the high-tech industry as well, because we got a solution. Now the solution itself can monitor that these device, what is the task it does, what application it runs, what services it runs. And then we have all this machine learning AI, it can profile it. You don't even have to know everything. It can profile it, and anything odd, it can say, no, 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 this is something we are not allowed in there and will not let it flow. That's right, we will stop it. So the point is like, it's like digitalization has been pretty important on that side in there, sharing of the data in the real time, getting all those different doctors to work together as a group instead of having everybody having their own opinion and all that in there, and having the records which you can see yourself as well as any of your doctors around the world. They can see it, they can pass their opinion, they can write their comment, even they can get on the conference call, have helped us come very far away from what were like just 8 years back when my friend has gone through that. Because of that, he has a second occurrence and he has to go through the second set of like all those kind of like chemos and everything else in there, which was a pretty tough. It's like somebody who was like a MLB player, and all of a sudden he has to kind of like go through something which is not kind of easy. So just like having learned from his experience what had made a difference between 8 years, it was a phenomenal that, hey, this industry has come long way. And from our point of view, when we are working into the cybersecurity or high tech point of view, we always have to see that, hey, how we work together to not only kind of like help them kind of like take advantage of all the innovation we are bringing, but take advantage of their innovation and then secure it. So all the things what Kavita was talking, having the control, who is supposed to see what data and all that in there, in the real time, able to visualize that who is seeing it, somebody is not supposed to see, if they are getting access, why they are getting access, stop it in the real time. So complete control monitoring and protecting it against anything going against in there and all that, that is really critical. If we are able to do that, and that's what is happening, is at the end, it's like as we were pointing out, some of the hospitals are on the cutting edge, they have a lot of budgets, so they can spend significant amount of like money on their IT and security. But then there are 95% of the hospitals, they don't have that kind of budget in there. So it is really critical to have a solution which is providing them comprehensive cybersecurity, instead of like hoping them that they will kind of buy all 20 different tools in there and then try to integrate, and they will have enough of the security staff to monitor each one and make a sense out of it. Because amount of the data being generated, that can be even in the hospital of like, let's say 500 beds, you might have multiple billion records are being generated every day. And those records, amount of the interactions they are having to profile it, no matter what you have, how many humans you have, it's not easy to do. So let the
Yeah.
machine pull it all together with the ML and AI, create that kind of like, hey, what is kind of like relevant and what is like anomalies and all that in there, then present that data at the command and control center when a human is able to make a decision into the real time. And sometimes, like when it comes down to the like IoT devices, we know exactly what service they serve and it has been profiled. If they are going out of those, you know that you have to stop and not let them impact the operation which they are supposed to do. And that is a something what is like being done from the cybersecurity point of view. That is a something critical which has to be done. And it's basically means like in our case, we are exactly doing that. We don't let any application which are not supposed to be there, any malware gets in there and is trying to do something out of the norm in there, it will just kind of like be neutralized. It will not be able to do anything out there without having to put a agent or any thing on that IoT device.
Thank you, Chandra. That was a detailed explanation with your own live experience. So let's have one more poll question for our participants. So I think this could be an easy flow as Kavita has given more on HIPAA. Okay, what kind of individually identifiable health information does HIPAA's privacy law protect? Paper, electronic, oral, all of the above. So we'll have 10 to 15 seconds for our audience to register their response. Okay, let's have the response. So Kavita, what is your stand on this poll question?
So, as we discussed, HIPAA is definitely one of the important regulation that is spread across and mandated across the healthcare industry. You know, the lot of data, patients' data that is managed, across the platform is humongous, and end-to-end cybersecurity is very important. And what kind of data that is being managed by HIPAA and why is it so important? As I previously quoted, the ownership of the data. Who owns who owns the data, and if there is any data breaches that happens or exploitation happens, who's responsible? So to answer this, HIPAA has brought in that humongous law or humongous regulation in practice to ensure there is a proactive and preventive measures taken on an ongoing basis to ensure the organizations take necessary measures to protect the data, as well as the patients are aware about what is happening with their data on an ongoing basis, and it is not lost or it's getting exploited at any case. That's why the authorization of the data is the authorization of the personal data or the patient's data is mandated to be used to be consented by the individual before it's getting used at any place. So the organization is both the organization and the individuals are responsible to protect the data and to ensure, for the organization specifically, to get the necessary consents in place, and the data that is stored in their network, which is usually by the electronic means, are supported by required or necessary security controls, be it with the access controls, with the necessary IAM controls that is taken care of, and the especially the security tool, which definitely, as Chandra rightly quoted, to monitor and to check on an ongoing basis. We have definitely need a complete monitoring system in place to ensure the data that is protected or the data that we are having in our network is protected from any external threats or the insider threats on an ongoing basis.
Yeah,
Over
definitely,
to you,
Kavita, I
Shiva.
agree that. But so I have a quick clarification. So
Yes.
healthcare services, they deal with the electronic PHI, which are required to be HIPAA and high-tech compliant. So though the current HIPAA regulations, it discuss on the aspects of confidentiality, accessibility, and integrity of EPHI, but they don't specifically address IoT devices. So this leaves an unanswered questions like, do we need an additional legislation that's concerning who will be responsible for the protection of EPHI and IoT? Either it should be a healthcare provider or a device manufacturer. So what do you think is missing here? Do we need an additional legislation, or do we need our legislation like HIPAA and high tech to be addressed even for IoT devices?
Sure. Thanks, Shiva. That's a very good question. So if you see, data security itself is developing, and the kind of innovations that is coming across the industry, specifically healthcare, is humongous. As we discussed in the beginning of the call itself, the kind of IoT or IOMT, or the vast kind of innovations that the industry is coming up with, has a lot of threats also, that is that it's increasing day by day. So is HIPAA and high tech alone is required, and do we have to need any specific controls around IoT or IOMT? Definitely, it is very important that the data that we are protecting, or the data that we are using on a day-to-day basis, is important across, not the kind of innovations or the features that we are bringing up, but it at the baseline, the security plays a very key role across different areas. And the same HIPAA also mandates, not at a specific device or application level, but at a holistic level, what the organizations are responsible for, be it with the kind of clinical applications that they are working on a day-to-day basis, or their websites that is getting used for the patient's use, or for customers response, or the networks that they are working on, or the databases where they are storing the data. There are many ways of protecting and securing the data, which is important, and some of them are very strongly called out by the HIPAA regulations. As you see, there are a lot of controls, or the elements that they bring under HIPAA. If you see, when they're talking about from the organizational requirements to the physical, administrative, and the technical safeguards, these are all talking a common language of three important bases. So first and foremost is protecting the data from unauthorized access, and second being ensuring the data that we are managing in our network are safeguarded from the external threats, ransomware attacks, which is significantly increased in the market. And third is the insider threats. And insider threats, when we're talking about, it's basically on a lot of administrative controls comes into picture, right from the awareness, the gap, that's a global gap that is identified in the network, and adhering to the standards and regulations that we are having in the market in protecting our data. So these are all some of the key components where the security or the regulation plays a key role. We should not be sticking into specifics of device, the medical devices, or the insurance or anything, because when we are talking about the regulation, it is common, but when you're talking about the specific to the standards, it differs definitely. Medical device, be it medical devices or pharma, or we take it payers, or insurance companies, they have their own set of important standards that is defined to comply with, and we'll have to definitely align to those regulations. However, HIPAA is a very high level important regulation, which the organizations are required and mandated to follow from the security standpoint.
Yeah,
Hope that
thanks,
answers your
Kavita.
query. If there is
Yeah,
anything more, please
yeah,
feel free to
thanks,
ask.
Kavita, for your
One thing I
answers.
was just going to add real
Yes,
quickly,
please, Chandra.
with
Yes.
Sure,
respect
Chandra.
to what Kavita pointed out, that different set of the devices when they're coming, when it comes down to the medical IoT devices in there, there is definitely FDA is very active because they know that those devices can be impacted by cyber threats. So FDA is definitely always, the device manufacturers are kind of getting contacted, or they are in contact with each other to make sure those devices, not only what they are coming new, but even those devices which are in the operations, they are being kind of like taken care of, and they are like not exposed to the cybersecurity threat. So there is a lot of the actions is happening by the FDA as well. But as she pointed out, there are set of like the HIPAA things are more about is like, it's like all and encompassing together. That's right. But at the individual levels, there are something you have to do, because as she pointed out, if you look into the cybersecurity point of view, any of the organization, especially in the healthcare industry, you have a IT part of your infrastructure, and then you have the IoT, the medical IoT part of the infrastructures. And you do not want in the most, if you want to do it right, you don't want them to be just like one network, because medical part of the your IoT network or medical operational technology, you want to have in completely into the separate network in there. And there, your operational view and then accesses are much more tightly controlled than what is happening on the IT part of the infrastructures in there. And we have seen, it's like, since I mentioned, I have been in hospital many times, so I end up inquiring a lot, but also I see that how they are acting and behaving and all that in there. So one of the things is very important that, it's like how you have a control, and the people are not passing across their kind of access control to each other. It doesn't mean that does not happen.
Yeah,
It does happen time to time that people just kind of pass their access control, but that is just something you don't want to be happening. But that is a one thing. But think about that. If somebody gets into those and neutralize those network, all of a sudden, it's like you are on now paper and pencil, and you don't have the historical view of what is kind of like this patient is allergic to, what they should not be given, what is their critical kind of like care needed at a different juncture. All of a sudden it can be life threatening. So one of the critical part is like definitely segmenting your network. So do the network segmentations, then you
yeah,
do the real-time monitoring of all the activities, and there it's very critical to have the machine learning and AI capability in there. And that machine learning and AI may not be immediately you want to apply to kind of start making a change, but let it learn, be there, and say the anomalous, at least alert a human, so human can go and take actions on those ones in there. So until something is like odd going on in there. So it's really critical for you to segment
yeah,
and segregate the
yeah,
IoT devices from the IT devices, do the continuous real-time monitoring, proactively detect any unusual stuff, whether it comes to down to the like unusual accesses, your privilege escalations, credential threats, or any new applications popping up all of a sudden in there, and you don't know about it, and then take a proactive actions to stop those. So that way, what happens is you are continuously able to improve your cybersecurity postures instead of you being left behind and looking at the end that breach has happened, and then you are doing the investigations. Investigation should be something you should have all that capability to see everything what has happened in there and able to do all the forensic, but that should be your last kind of resort. The first resort is like monitor, detect, and stop, so that you don't have to go into the last resorts in there. But that's something you need for the compliance purpose, that you have been able to do that, and you have all the records about it as well.
yeah, definitely, Chandra. So we can audience can post your questions in the chat, so we can discuss at the end of this call. And Kavita, just want to So have you faced any ransomware, Kavita and Chandra, have you faced any ransomware attacks in your previous experiences? And if so, how was the situation handled? Can you please share your experience?
Yes. So, Kavita, you want to me to go
Go ahead,
first?
Chandra. Yeah, please go ahead.
So see, we are in the cybersecurity industry, and I mentioned that we have more than 5,000 customers around the globe, and definitely many of our customers have kind of like this cyber, like especially when you have the ransomware attack, those ones have evolved over the period of time. So if you look into last 4 or 5 years, there has been a lot of evolution into those, and now you are seeing is any of those attacks are multi-step multi-vector attacks. So just to give you some simple idea in there, what that does it means is first they have to compromise a credential, and the credential compromise might happen because of the social engineering. You know, you are on the social network, you left your login password has been exposed. People can figure out most of the time what is your the login ID, and then just guessing the password and all that. Sometimes you might had a door open in there, they are able to do the brute force. Sometimes the phishing email and you click in, they will say, okay, you got this and that, or somebody send you email, you change your password, and basically they get your password from you as well. That's right. So credential compromise, or sometimes they may dump like somewhere, some devices like have a vulnerability, they will dump all the login password, use that. So credential compromise happens, then things get into there. Now, based on that user privilege, that privilege might be admin privilege, they are able to go and do a lot of discovery, bring some new applications and all that. Sometimes privilege has to be escalated. So you have to do the privilege escalations, create a new credential because you might have a privilege monitoring capability. So create a new credential and so on and so forth. And then after that, you drop something as a malware, and now all of a sudden you are doing the discovery of the asset, trying to collect the critical data, and then exfiltrate the data. And then only last thing comes in where you put a bot and do the encryption and all that in there. So anybody who has gone to the last point where the encryptions and all that has happened, or is it happening and you are detecting, you are pretty late in the game. There is a lot of things has happened. Your data is already out in the public domain. They have stored into sub-encrypted facility and all that in there. So you don't want to be in that situation. From 4 or 5 years back, people will say, oh, I have a backup, and because of my backup, I'm secure. Now the attacker takes time to destroy the backup, time to discover there is a backup going on. Let's destroy the backup as well. So you don't have that options as well if they are sophisticated. So we have seen in our like almost like 5,000 plus customers, we have seen multiple of them, those attacks has come into the like initial stage. But the having a solution, what Kavita had pointed out earlier, that having that continuous real-time monitoring, detecting those, whether it's a privilege breach are happening in there, or you have like command and control center being set up in there, your lateral movement where discovery of the asset is taking place or collection, you are able to put a story together automatically in the platform and detect, you are able to stop. So our solution, one of the key part is it is able to pull all that story together and detect those and say that, hey, this is a ransomware in progress. When you have that kind of alert comes out in there, people take a action. Where there are certain alerts, they may say, okay, you know, it's a brute force and all that. I want to wait, or whatever, if there is a breach has not been successful and so on and so forth. But when you say ransomware attack in progress, people take actions in there, and there you are able to proactively stop it before it become too late in there. That's right. So we have dealt with many of our partners where they had seen those ones in there. And then the real critical thing is, as she was pointing out, having the complete story come alive. You cannot just say that, hey, this is what trying to encrypt it, it was miming cards and all that in there. That's because if you don't have the whole story to tell what has happened and what the progression has been there, then you are kind of like not able to give that confidence to your end customer. But once they see that, and they are pretty kind of like excited that, hey, at least I didn't go to the point where my data had been exfiltrated and encryptions are happening. And that's something we have seen a lot. It's like even 4 weeks back, we had one incident, we saw that something was in progress. and we were able to get that customer on the call, policy was applied. So you can put automated policy to stop it. Sometimes people kind of do the push button and all that. They did the push button, stop it, and it didn't go through. It's a really critical to proactively detect those into early steps and stop it. Then going into the last point where you're saying, oh, I detected it, but by the time you detected, your data is already out, and you will be now the people, you keep on hearing this quad kind of like exploitations. So those quad exploitations will start taking place in there. And as I mentioned earlier, and we discussed that healthcare industry is something is more likely to pay the ransomware. And the reason is because of the kind of the data which is involved into those breaches. So we definitely, for them to stop in the early steps and early stages is a much more critical than going into the last step when that breach has taken place and now you are doing investigations and then forensic and also because that's too late at that point.
Definitely. So, Chandra and Kavita, so we have 4 minutes left, and we have two questions from audience. So, I'd like to bring up those questions. Is there any specific reason why healthcare industry is seeing increased security incidents of late? How do we ensure employee address data security issues in healthcare? So these are the two questions posted by audience. So I would like Kavita to address these questions.
Sure, that's a very good question, team. So, if you see why healthcare has been chosen now and why healthcare is undergoing the ransomware attacks, and day by day, when we open up LinkedIn or Insta, the first at least one news you would see that a healthcare industry has been affected by ransomware. Why? So the big question is, as this previously it's not like it was not there, but when the COVID situation arised, that's when a lot of cases also increased. You all know that there are a lot of or the patient's data that has been evolving or that has been rotating humongously. And when there is the data that has been revolving around, the hackers or the cyber criminals took this as an opportunity for business, I would definitely say, because it is not simple that exploiting the healthcare reports, the healthcare records, or the patient's information is simple in nature. And the healthcare industry is something where they were not very strong in the security controls. They were very weak over there. And when they are weak, and the data that is the patient's data that is increasing day by day, and they are able to make money in the dark web, that's when healthcare has been targeted, because they are weak in the controls, as well as they have humongous data that is getting stored in their network, which can be utilized and make money. That's when the ransomware this particular attack itself came into picture significantly during this COVID period. But how to improve? How do we as an individual ensure that is not affecting healthcare industry specifically? Because the organization is missing one thing. The cost of investing in building the security controls is much better than paying for the ransomware. If once they understand that paying instead of paying for during a ransomware attack, they can invest in ensuring they are safeguarding their data, be it upgrading their legacy system which is currently in their network, or applying the software updates, or upgrading their systems on an ongoing basis, improving or implementing the latest technology, the cybersecurity technology that is improved, be it secure tools or the access controls in the network. They have to ensure that they are enabling their systems and strengthening the environment much better than paying during the ransomware attacks is something which is understood and known by the industry currently, and they are trying to enhance their capabilities at hospitals.
Definitely, Kavita. So, Chandra, we have one audience question. With any recommended tools for prevention? Do we have any recommended tools?
You look into the cybersecurity point of view, there are like, if you see, there are two main domain into the cybersecurity. There is one which you can call it cyber hygienes, which any organization should have, and especially if you are in the healthcare provider, you want to make sure that you have the hygiene part, which is basically your firewall, your like gateways, email gateway, web gateways, identity management system, which might be AD, Azure AD, whatever you are using, your then AVs. And then the second part, which is basically kind of gets into making sure you don't have those uh, ransomware kind of attack. And that is where it comes down to the CMDS, your continuous real-time monitoring, proactively detecting the threat and automatically stopping it, or push button is stopping it. And then you meet all the compliance requirement and all that. So these two domains are very critical, but at the same time, if you don't have the first domain itself taken care of, you don't have the hygiene, you cannot be thinking about the second domain. They go in hand, and then what you do is they have to work into the closed loop, so you are able to keep on improving your cybersecurity postures each and every day. It is really critical to put that the levers in the control, and it then have to be like out of like reach for most of the kind of the companies out there, because one of the things what the Sakyan has done and which the GAPS is offering on the CMDS point of view, you don't have to spend millions of dollars to get into like 10 different product and 20 people to run that. And that is something, a platform which work with your hygiene side, but it's able to give you comprehensive visibility. You monitor everything in the real time with the machine learning, AI, dynamic threat models, and they take the threats before it is too late for you, that where you have been compromised and now you are kind of going through millions of dollars of payment. And the biggest thing is not only the payment, your operation being down, that is the biggest kind of like also challenge in there, and the stress and then the impact it have on your business going forward, as well as your patient which are there, and you don't want them to be suffering or they to have a doubt about your capability going forward. So it's a better, as Kavita pointed out, to have a solution which keeps you kind of focus on your core business than worrying about the cybersecurity and the ransomware attack, are not being in compliance with the HIPAA, those kind of things, you know.
Sure, Chandra. So, Chandra and Kavita, we have reached the end time. We will respond to other questions from audience over mail. Audience can also reach out to us at inquiry@gavstech.com. Thank you, Kavita and Chandra. It was really a delightful session. I believe through this webinar, everyone would have gotten a fair understanding on the healthcare cybersecurity and the hygiene for cybersecurity. We will come up with other such important and interesting topics in the near future. So once again, thank you. Please stay safe and happy week ahead. Thanks once again, Chandra, for taking your time out for this. And it's a good opportunity that we were able to get insights from you on the industry part, and also from through Kavita on the healthcare vertical. So it was delightful that we had this webinar. Thanks once again.
Thank you everyone.
Thanks, Shiva. Thanks, Chandra. Have a good day, and thanks everyone for taking time. Bye.
Bye for now. Yeah.
Bye. Thank you.